morning. My name is Dean Brouder, and I'm the Drug and Alcohol Resource Coordinator from Methuen Public Schools. I'm very excited about our first show this year in 2015. Today's guest is one of my favorite teachers in Methuen Public Schools, and her name is Jackie Rubino. Good morning, Jackie. How are you today?
Good. How are you, Dean?
Good. I'm doing fine. Thank you so much for coming on the show, our first show of the year. And today we're going to talk a little bit about the prevention model. We've heard a lot in the local news, the sad news about the opiate overdoses, and a lot of times people want to know, what are the schools doing in terms of drug prevention? And you and I, if you could start off giving us a little background on the SADD program.
Sure. 7 years ago, I started teaching at Methuen High School, and you and I obviously had a wonderful relationship from the start. And you brought the SADD program back to the high school, which had been gone for many years. So naturally, you know, I got involved with you and the students, and we've had the program now back at the school for 7 years.
Jackie, the SADD prevention model, what is it all about? What are we trying to do? First of all, it's Students Against Destructive Decisions, but what does that really mean, and what are we trying to do in terms of giving our students an opportunity to stand up and take ownership of themselves and live a more healthy lifestyle?
Well, originally we had a small group, as you recall, of kids who were freshmen who had seen what was going on around them at school, and they didn't want to get involved with the drugs and the alcohol and everything. So they wanted to create a space for them and, you know, 15 of their friends to hang out and, you know, help others and volunteer and go on trips and have fun, where they didn't have to worry about being pressured and being exposed to all that behavior. So we've just expanded. We started at the high school level, and now we have all the grammar schools involved, and we have grades 7 through 12 opportunities for students to go on field trips, bowling, skating. We're doing ice skating this year, volunteer work, and, you know, just promoting good citizenship, helping others, but also having that social aspect where you go and you have fun, and it doesn't involve substances.
And I think that's important for the public to understand, that there are things going on in the schools on a daily basis. Mm-hmm. And it's a difficult transition for kids to make from the grammar school, where they feel more comfortable staying with their friends and whatever, and say no to drugs or whatever, and to come to the high school. You not only deal with the high school SADD students, but you also deal with the grammar school kids. What is the biggest difference do you see in terms of the difference?
The major difference, I think, is the exposure to substance abuse. I think that in school, rather. I think that the 7th and 8th graders, they tend to not have as much experience, you know, until they go into high school, with seeing it right in front of them and dealing with their friends who they've been friends with forever, you know, pressuring them to drink or to do drugs or to try something. I think that once they get into 8th grade, 9th grade, that's really the time where kids start really getting into that and experimenting. So, you know, starting at a younger age is really important to start, you know, the prevention, and even, I mean, it should be even earlier than 7th grade.
Sure. It appears that everyone has been touched by substance abuse. I know in my own family, my family's been hurt terribly with substance abuse, and it's one of the major reasons why I continue to do this work so many years later. Mm-hmm. Could you give me a little idea about why you came and chose to get yourself involved with me with SADD?
Yes, I too have been affected by substance abuse. My cousin, who was 19, passed away about now it's 9 years ago, and he you know, was very close to me, and he had the same upbringing I did, you know, great family, great parents, very supportive, very involved in athletics, and I saw him, you know, just deteriorate and go from pain medication use to heroin to overdose and death. So, you know, I wish that he had someone at his school or some figure in his life that knew about what was going on, other than his family, and obviously he hid it from us. But I wish he had some place to go, maybe in school, that could have helped him. So I really feel passionately about the cause, because if I or the other advisors or other students in the group can have an effect on one person and change their course in life, then that makes me feel good.
And so, yeah, that's a very, very sad story, and unfortunately more and more people are dealing with that, and it's so shame-based. Addiction is one of those things that even today, people don't feel that comfortable sharing their experience. Mm-hmm. And this show, if anything, we're trying to give parents an opportunity, if you watch, students, staff, any members of the school community, to see that we're out here, we're trying to do the work. We've been doing it for quite a while. We always need room to improve, but we have a lot of things going on, and I want to make sure that the ladies, the SADD advisors at the grammar schools, get their notification, because without them, they are the backbone of prevention. Mm-hmm. It's easy to come on a show and talk about it, but it's what do you do during the course of a week or month, and to get these kids involved in that drug-free activities. And so we have the ice skating one that we've been putting off for a while because of the weather. But that would be an opportunity where kids get together from different schools. They see their teachers in a different light. They get to get involved in healthy activities. We also have the big Relay for Life coming up. Mm-hmm. And SADD has been involved with the Relay since the beginning. And you have been involved with Relay. I think every year, depending on the year, SADD's involvement is either larger or smaller. Last year you had a group from the CGS come, mm-hmm. and some kids from the high school. You're instrumental in the Relay for Life. Could you give us an update on the Relay for Life in Methuen coming up in June?
Sure. So I'm one of the adult leads. I have been for 3 years, so I'm really excited about this year. We should have a great year. The Relay is May 30th through May 31st. And it's an 18-hour event. It starts early in the morning and goes to the next day. This year, we're really hoping to get some other communities involved. And traditionally, it's been a Methuen, Merrimack Valley event, but really, it's been driven by Methuen students at the high school. But we've involved Andover and Lawrence and North Andover, so we're getting some more involvement from other communities, and the kids are meeting students from other towns. So we're really excited about this year, and we've been going since September. So.
Yeah, and I admire all of you that are involved, and a lot of it's usually student-based, but without you guys, without the adults, I don't know. It's an example, like, what does Relay for Life have to do with substance abuse? What does it have to do with drug prevention? I think we both agree that it has everything to do with it. We have a community-recognized disease, cancer. It's been, all of us have been touched by the insidious disease of cancer. The community recognizes it, it comes together, it raises a ton of money for research for cancer, and that's an example of a community recognizing a problem affected by all, children to very old, and they come together and they have a fun time. They raise a tremendous amount of money, what, over $1 million so far?
Over $1.5 million.
Over $1.5 million. And that's an example of a community coming together, recognizing a problem. Do we ever think that we could do something like that when it comes to substance abuse with the heroin addiction model? I don't know. I don't know the answer to that. Again, it's because it's so private. I think that would be a problem, but it's something that we could discuss down the road. The nature of this particular show is that we're going to be having different people come on the show, some that are actually doing work in the Methuen Public Schools on prevention. Also, there will be some people coming in from the community to tell their stories. I want the community to know when they do watch the show that we will have a phone number directly to me. If parents have any questions or anything, any topic that they'd like for us to explore on the show, I'd be happy to include it to make it a little more inclusive. And also there's a website that we have this year. Jackie, could you tell us a little bit about the link that we have to Methuen Public Schools website about drug prevention and what have you?
Sure. If you visit the Methuen Public Schools website and search for health and PE and wellness, you can look for the drug abuse and prevention website, and we have all sorts of information about what you do with the schools, with the students, and what we do for prevention with the SADD program. So if you just go to the Methuen Public Schools website, look for the Health, PE, and Wellness, and then search for Drug and Alcohol Resource page. There's all sorts of information and links there. There's also updates and pictures about what the students in the school are doing, both in the grammar schools and the high schools, to help their fellow students prevent
That's
drug
great.
use.
I want to definitely tell the community, if you're interested in listening to stories about addiction, Phil Leahy's cable show, it's available. It's on their website. He's an excellent resource, and it would behoove you to check out his support group as well. We're all a team. We're all trying to work. And Jackie, I want to thank you so very much for being my first visitor this year.
Thank you for having me.
And without you, much of what we do here for drug prevention in Methuen Public Schools, I'd really struggle. So thanks again so much, day in, day out. Thank you very much. Please see us next week when we have 2 students from Methuen Public Schools who are SADD members, and they're going to speak also about the Relay for Life and their involvement with SADD. Thank you very much. See you next week with Let's Talk with Mr. Brouder.